I welcome you all in this clinical meeting of Thalmic Society of Pakistan at MUGHAL Hospital. Before we start, I would like to call Hafiz Javed Saab for a recitation of few verses of Holy Quran. Please.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم.
Now I would like to call President OSP, Dr. Qasim Latif, for further proceeding. Sir, please.
To all the participants who are attending this yet another OSP meeting. Our format is that we'll have 4 cases which will be presented by the PGs, and we have 2 judges, Professor Malik Musaf, my teacher.
Our presentation for today is Clearing the Fog in 3 Weeks by Dr. Mahnoor Salman. She is second year resident. Dr. Mahnoor, please.
Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Mahnoor Salman, second year resident of Mughal Eye Hospital. And today I'll talk about how we cleared the fog from our patient's eye in 3 weeks. So my patient was a 16-year-old male student, and he was a diagnosed case of keratoconus. So this is the topography of the left eye, which shows steep corneal curvature and thinning. This is a topography of the right eye, which also showed corneal steepening and thinning, but less than the left eye. So the patient underwent deep anterior lamellar keratoplasty from Mughal Eye Hospital.
Phaco, the role of MIGS in complex angle closure management by Dr. Fahad. He is a final year resident. Dr. Fahad, please proceed.
Assalamualaikum. My name is Dr. Fahad Ijaz and I'm a postgraduate resident in MUGHAL Eye Hospital, and today the topic of my case is Beyond Phaco, the role of MIGS, minimally invasive glaucoma surgery in complex angle closure management. So my patient, he was a male, 56 years of age. He presented to the OPD with the complaint of sudden pain in the left eye. There was loss of vision, redness and watering for the past 4 days. He was a non-diabetic, non-hypertensive, and there were no other comorbidities. The surgical history was also unremarkable. He was a non-smoker, a non-addict, he had a normal appetite and a normal sleep-wake cycle. As far as the past ocular history is concerned, he was using glasses for his diffractive error, but there was no other history of either laser, injections, trauma, or surgery. And these are the gonioscopic pictures of the 4th post-op day. You can see here that we couldn't approach the superior angle, so it remains closed, whereas we did goniosynculisis on the inferior angle, so you can see an open angle is seen. These are some of the articles that support our procedure and its findings: the effectiveness of early lens extraction for the treatment of primary angle closure glaucoma, the EAGLE study, whereas the effect of phacoemulsification plus goniosynculisis in acute and chronic angle closure patients with. Thank you.
My name is Dr. Rehma Shahzad Bhutta. I am a second year postgraduate resident at Mughal Eye Hospital Trust. When the eye defies the script and the shadows lead astray, strip the impostor's mask to let the truth find its way. With this, let us discuss a curious case of an intraocular impostor. On 3rd of March 2026, a male patient, 35 years old, resident of Patuki and a factory worker, presented to us in OPD with a decrease of vision in right eye for 1 month following a trauma by a metallic object. Digging into the history, we came to know that the decrease of vision was sudden in onset following an injury sustained by the space embedded in the retroorbital fat, lateral to the optic nerve complex, and you can see the globe integrity is maintained. This is the reporting of the CT scan, which states the small metallic foreign body in the right retrobulbar intraorbital region with metallic artifact. And sir, the vitreous hemorrhage is settling. We will wait for 3 months. After that, we have to intervene surgically. RD. Sir. Sir.
Should we wait for the hemorrhage to absorb?
Second. Cirrhosis, yes, cirrhosis. Yes.
Thank you, Rema. Thank you for highlighting that sometimes just doing nothing is what is required. Now let's hear from Dr. Aksar Rauf. Treatment turned into toxic. Thank you.
Assalamu alaikum. Bismillahirrahmanirrahim. Steroids when therapy turns toxic. Dr. Aksarov here, resident of second year ophthalmology at MUGHAL Hospital Trust. Bringing you a case of 5-month-old male child presented with a complaint of watering and discharge from left eye for 4 months, difference in size of eyes, left eye being bigger for 1 month, and loss of left eye luster for 1 month. According to mother, patient had watering and sticky discharge from left eye, for which a local practitioner advised some topical medication and sac massage. The drug was used continuously for 4 months by mother. When she started noticing a difference, so a take-home message for the day is a simple steroid drop may quietly steal a child's sight, unseen and slow. So tread with care, watch closely, and act before the shadows grow. Thank you.
Now, moving further, we are honored to have Dr. Madam Taiba Gul as a guest speaker. She is head of Department of Ophthalmology at Lahore General Hospital. She is chief editor, and she has recently started subspecialty in glaucoma, and under her leadership in Lahore General Hospital. Madam, please, we would love to have your thoughts.
I came here at the first clinical meeting, and now I see there is a huge difference, much improvement in the clinical cases, mashallah. Tajam Jana meeting. And secondly, I also want to congratulate the chief executive and the faculty college. We were taught that you check the intraocular pressure, you do the optic nerve examination and check the visual fields, and then you come to the diagnosis of glaucoma. We used to have the TSNET graph, TSNIT, उसको इसको TSNET भी बोलते हैं. What Donald Good did, the center. So some of might be the earlier damage could have been missed in that splitting. तो उसने क्या किया कि जो most important part of the retina था उसको वो center में ले आया. So he converted the TSNET scan to N-STIN scan, where this area, which is the most important area, was brought in the.
Our next speaker for today is Dr. Nabil Ahmed. He is FRC of his PhD in Vision Sciences, Fellowship in Glaucoma, Medical Retina and Uveitis, Fellowship in Cataract and Advanced Anterior Segment Reconstruction. He's currently working in Amanat Eye and Ibrahim Eye Trust. So please, we welcome you to share your insights.
All right, Ji, thanks a lot. This is very honoring and quite humbling. I'll be very frank with you. I want to extend my deep gratitude to Irfan and Dr. Taiba for letting me have this chance to talk to all of you guys. All right, without further ado, I'll kick off my presentation. I had my cons when Irfan told me that I need to talk about this, and when I was told that I need to talk at MUGHAL, I was like, oh, that's no problem. That's where my buddy is, And there are very few people these days who learn and teach at the same time, and Dr. Saad is one of those. So it was quite an honor to come here and talk about this. This would be the layout of my presentation. I'll try to lay down the groundwork, and then I'll talk about where does interventional glaucoma and these MIGs, these fancy new words that keep popping up and everybody starts talking about these days, where do they fit in, and what does the future hold? I mean, 10 minutes doesn't really cut it, but I'll try to be as brief and to the point as possible. All right.
Thank you for highlighting the gaps in the advanced glaucoma management, and the idea of conducting the workshop is much appreciated. Our next speaker needs no introduction, Dr. Javed Chaudhary Saab. He is teacher and mentor to, all the young ophthalmologists.
And the old ones. And the old ones. And the old ones.
बिस्मिल्लाहिर्रहमानिर्रहीम सबसे पहले तो आई एम वेरी ग्रेटफुल you called me here. Before starting anything, I would like to congratulate the administrator of Mughalai Hospital and faculty, Professor Brigadier Tariq Shakur Sahab and Professor Mehmet Sheikh, and especially Dr. Shahbaz. You have developed this institute in a very, very good place. What I have seen outside, माशाल्लाह फूल ही फूल हैं, बहुत अच्छा लगा, बहुत खूबसूरती है. फिर आपको मैं ये भी मुबारकबाद देना चाहूँगा कि आपका जो फर्स्ट फेलोशिप आपको प्रोड्यूस हुआ है, आप इनको एनकरेज करें तालियां बजाने के लिए. ठीक है? अच्छा, और अपार्ट फ्रॉम दैट I have felt that among all trust hospitals, probably as far as education is concerned, as far as academic activities are concerned, now Mughal Eye Hospital is going ahead. That's very good. दूसरी बात मैं जो इस वक्त सिर्फ मुझे पता है कि नाउ वी आर गेटिंग लेट, किसी दिन फिर ग्लाकोमा में बात करेंगे जो आप लोगों के लेवल की. तो यंगस्टर्स के लिए मैं सबसे ज्यादा इस वक्त जो इम्पोर्टेंट चीज समझता हूं कि द burden of blindness due to glaucoma is far beyond your imagination in Pakistan.
And I must say, wonderful presentations, and really had a very good time here. I would request Professor Dr. Qasim Lateef Sahab and Professor Javed Sahab to please come on the stage. We have to announce the positions. Sir, आप दोनों आगे